Member for Delta South.
Thank you, Mr. Speaker. Lane French from South Delta suffered a stroke in the Massey Tunnel and was left paralyzed and alone. Despite urgent 911 calls, French was told to fend for himself, and I quote, "Nobody came. They left me abandoned on the side of a road to figure out my own way," end quote. Lane French and countless others deserve more than excuses, and I feel your pain from this incompetent minister. Mr. Speaker, when will the Premier finally act and fire this minister?
Minister of Health.
Thank you very much, Honourable Speaker. And we're concerned every time that someone has challenges in facing the healthcare system. I know that our healthcare professionals, in particular, our ambulance paramedics and dispatchers, who address these issues every day, are so concerned. And that's why, Honourable Speaker, when I became Minister of Health, after 16 years of Liberal government, Honourable Speaker, the majority of ambulance paramedics were casual, the majority. We've increased the number of full-time ambulance paramedics, full-time, from 1,500 to 2,600, and the members know this, Honourable Speaker, in 6 years, Honourable Speaker, that for purple calls, Honourable Speaker, we've reduced wait times over that period, Honourable Speaker, which are the most serious calls, and including in the last year. Because we've invested, Honourable Speaker, in ambulance paramedics, in particular in rural and remote communities. We've added, Honourable Speaker, air ambulance services across BC. So when the member talks about ambulance services, unfortunately, he knows that we can't and we won't go into individual cases, although we express in every occasion our compassion for people. But on the ambulance service, which had been neglected for a decade, Honourable Speaker, where ambulance paramedics had been treated with contempt by the previous government, the only group of workers who didn't get the public service bonus under the previous government were ambulance paramedics. We've made changes to that, and we've done it working with our ambulance paramedics.